Hi, welcome to ZC HealthLink. This video would demonstrate completing an application for a family, as well as selecting a plan for the family. First, to create an account, click on Individuals and Families, and then Apply Now. The account is being registered as for an individual or family. Enter the first and last name of the account holder. Enter an email address for the account. Entering an email will enable you to retrieve a forgotten username or password. The password you select must be between 8 and 20 characters, contain at least one uppercase, one lowercase, a number, and a special character, such as pound or exclamation. Cannot contain your username, first name, or last name. After you've typed in the password twice, you'll see an image with text or numbers. You must type the text that you see in the box below. If you cannot view the text in the image, simply click on the double arrow icon right here to get a new image. When you find an image that you can read, type the text in the box. Click on Create Account. Now, log into the account with a username and password. When you first log into your account, you'll be prompted to select 3 security questions and your answers. After you've entered your answers, click Continue. A consumer can select an assister or broker to submit an application and select a plan on his or her behalf. If a consumer is looking for a training expert, they can click on Search for a training expert at the top. Here you can enter your zip code to find an assister or broker near you. When you click on an icon for an assister or broker, their information will pop up. You can also click on More Information to read more about the assister or broker, as well as select that particular assister or broker as your training expert. If you already know an assister or broker who you would like to work with, ask for their reference number. Once you have the reference number, you can select them as your train expert by going to Select Train Expert Assisting You at the top. You can enter the assister or broker's reference number, click on Search, see their name appear, right here. Click on Next and then confirm them as your trained expert. Now we'll go back to the home page of the consumer's My Account by clicking on the consumer's name at the top right. Here, the consumer has 5 options. The first is to apply for help paying for your health coverage. The second is to apply without financial help. The third is to find an already submitted application. The fourth is to browse plans without completing an application. If you select this option, you'll be prompted to enter your birth date as well as your zip code. Then you'll be able to view the plan premiums for the plans offered through DC HealthLink. The last option is for employees whose employers are participating in DC HealthLink. Today, I'll be demonstrating completing an application for financial assistance, which is the first option at the top. Consumers who are applying will select for myself and or my family. You can review our privacy statement here. These are the terms and conditions that will allow us to use the information you enter in your application to verify your identity. The information you enter will be verified against Federal Data Hub information. In this section, you will enter your contact information, address, and social security number. If your address includes an apartment or suite, enter it in the line 1 or line 2 of the address. You may enter another mailing address if it is not the same as your home address. Here you can enter your preferred contact method. Also enter your phone number and an email address. After you've entered the contact information as well as the social security number, you'll be prompted to answer a series of questions. These questions are to verify your identity and are questions that are taken from tax databases as well as other public sources. Here, the primary applicant can enter information about other family members. You should enter information about everybody in your tax household or anyone who lives with you, even if they're not applying for coverage. Here, if Amy, who is the spouse of Daniel, has other coverage, such as through her employer, and does not wish to apply for coverage through DC HealthLink, she can select no. However, in this demonstration, Amy will be applying for DC HealthLink coverage along with her husband. If a consumer is a naturalized citizen, they will be prompted to enter information about their day of entry into the U.S. and for documentation. If there are no additional family members to enter into the application, simply select no for do you need to add more people. Here you will select the relationships between each member of the application household. For applications for financial assistance, you must enter income information for each member of the household. Here, the members are asked if they will be filing taxes in 2014. Spouses are asked if they will be filing jointly. Here we can enter income for Daniel. Be sure to enter the right frequency for the amount. This question is related to adjustments to income such as child support and other incomes. You should refer to Form 1040 for more information. Here you'll be asked about whether anybody in the application group is incarcerated or currently enrolled in a health plan or already enrolled in employer-sponsored coverage. In this demonstration, both Daniel and Amy are not incarcerated, nor do they have health coverage through their employers or other private coverage. Here you can review the information entered on the application before submitting it. If any of the information is incorrect, you can click on Change to change the information regarding Amy. You can also add any information that you did not enter. Another way to go back into the application to correct or add information is to simply click on one of the pages on the left that will let you go back into the previous pages. Once you review that the information is correct, click Next. If you're a broker submitting this application, you will select Yes and then enter your TPA number or your MPN. Here, certain pieces of information entered on the application cannot be verified. Note that this does not prevent Daniel and Amy from enrolling in a health plan. They simply have to submit documentation to show their citizenship and their wages and so forth within 90 days of submitting an application. You can also click on verification requirements and timelines to view the kind of documentation that will be accepted to verify certain types of information. Now let's go back to TC HealthLink application. After reviewing the application information and agreeing to the terms, you can sign your application. Note that you must sign the application exactly as you typed it on the first page. Any extra spaces will generate an error message. Once you've successfully submitted an application, remember to jot down the application reference number. Here you can view the eligibility results for the application. Daniel and Amy are eligible for assistance to cover the costs of purchasing private insurance through DC HealthLink. They are eligible for advanced premium tax credit of $44 per month. To enroll Daniel and Amy in a health plan, we will click on Enroll in Health Plan. We will select both Daniel and Amy since they both want coverage through DC HealthLink. In a situation where only one member of the household would like to select a plan, let's say for instance Amy already has coverage through her employer, you can deselect Amy and go on to select a health plan for Daniel. In this scenario, we're selecting a health plan for both Daniel and Amy. Here we're selecting a primary contact for the account. We will select Daniel. And click Start to shop for plans. Here both medical and dental are selected. Let's first select a medical plan for Daniel and Amy. You can choose to narrow the number of plans by the meta level. Let's say that Daniel and Amy are looking only for silver and gold plans. You can also select the amount of deductible for the plan that you're looking for. In this scenario, there are 12 plans available, and they're all within the same deductible range. Click on View Plans to see all the plans. You can narrow the selection by clicking on a specific insurance company. Here for this particular plan, the deductible is $2,600. You can view the plan details by clicking on View Plan Details. Here you'll be able to view the provider directory for the plan. These are the doctors and hospitals and other facilities that are participating in the plan's network. You can also view the summary of benefits coverage. The summary tells you the deductible amount for a person or individual, also tells you the copays for certain types of services. You can also return to plans after viewing the detailed information by clicking on this button, Return to Plans. The premium shown here is the family premium for both Daniel and Amy. To view the individual breakdown, simply hover over Family Cost Breakdown. As you can see here, the monthly premium for Daniel is $226. For Amy, it's $247.68. Let's say Daniel and Amy chooses this plan. We can also shop for a dental plan for Daniel and Amy. Here are the dental plans available. Here, this is the monthly cost for both Daniel and Amy. You can also view more details by clicking on View Plan Details. Let's select this plan for Daniel and Amy. Here you're shown the summary of the medical plan selected for Daniel and Amy, including their tax premium. Sorry, I mean premium tax credit of $44 per month. Including the dental plan for $33.28, their total is $46.61. Once you're sure that this is medical and dental plans for Daniel and Amy, we can click on Enroll. Here you can choose to apply all of the $44 or 85% of the $44 or none, or you can specify a specific amount. Let's choose all of the premium tax dollars. Here is a summary of the breakdown for each member of the household, Daniel and Amy, their medical plan premium, as well as their dental plan premium. You can click Continue to view the summary page again. Here is the effective date of coverage, as well as the subsidy amount. After reviewing the terms and conditions, the consumer will once be prompted again to sign the plan selection under the primary applicant's name. Once you get to the congratulations page with a summary of the family members and the plan selected, you have completed a plan selection for the family. You can print this page for your confirmation.